So I'm just gonna go over the Bible, and then really quick. I know I didn't have time to like do this, but I mean, if you guys have time, go over it. So I am starting on 42, or let's do 400, page 400. So if somebody is having a difficult, somebody is choking, right, because they didn't chew their food correctly and they're having a hard time swallowing, you want to make sure that you first assess if they can't cough, they can't breathe, and they can't say anything out. Then you want to perform the what's it called, the hitch something maneuver. If they can kind of talk and they can kind of cough, then you want to let them do it by themselves. Babies choking, if they're choking, you want to flip them upside down and like tap hard on their backs, but you want to have them kind of like leaning down in a way, like their body's positioned a little bit downwards. Unconscious person, you want to like, you don't want to do any blind finger sweeps. Types of anaphylactic shock, you want to make sure that you know signs and symptoms. So tachycardia, right? Fast, weak, thready pulse. So you're going to have tachycardia, weak and thready pulse. You're going to have low blood pressure. The patient is going to be cold, so make sure you give them like a warm blanket. You also want to assess for respirations increase. Oh, and you have a decrease in urinary output. ETI sometimes asks about that, so you're going to have like oliguria. Blood pressure, is often steady, but it decreases to low blood pressure, very cyanotic, but they're going to be cold and what do you call it? They're going to have a low urinary output. So always stabilize it, right? And then for epitoxis, if they're bleeding, right, you want to make sure they're leading forward. You put pressure on the nose, eyes on the top right here. Says 10-15 minutes. Place steady pressure, ice over the nose. So yeah. So 4-finger, place steady pressure on the bridge of the nose. Lean forward. Oh, and you want to have an emesis, I think. An emesis will container for the next one in case you throw up. Make sure they breathe in, through their mouth. Success, less than 20 minutes, right? The ice. Internal bleeding, dark terry stools, hematuria, those are bleeding. You want to make sure you're like bleeding precaution. Picture for wounds, you always put more pressure on it. Never take it off, right? The chest, you want to make sure it is like if somebody something penetrated chest, you don't want to like take it out, because what happens is if you take it out, it can cause a flail chest, which is where 2 or more ribs are fractured into 2 more, please. Okay, never mind. You get skip this part. Just know that don't take anything out of it. Mobilize, apply pressure, paradox motion. Make sure that it's an underlying injured area. It's like bulging on aspiration. This is I can show you what it is. Paradoxal motion. It's on page 408, figure 16.4. Make sure you know that. Please. Alcohol 0.08 is the limit. It doesn't really ask you about that, but you want to know. A brace, always rest, ice, compress, elevate, no more than 20, else you get rebound. Rules of 9. I didn't go over rules of 9, but rules of 9 you gotta know, like by law, like you gotta know. Rules of 9 is where you have your face is 9. Think about this. Your face is 9. Your arms are going to be 9, right? Because hold on, I'll explain. Your face is 9. This arm is 9. This arm is 9. Now take your body, right? Take your body. Think about it as like a chess, like chess set, the little rectangle thing, and it has like little dots. Is that chess? That's not chess, right? Dominoes? Is that in dominoes? I don't know. It's dominoes. I think it's dominoes. Not chess, chess is something else. Dominoes. the little dots, right? And then it has a little line in the middle and it has more dots at the bottom, right? And when you turn it around, it has, you know, the same number, like 6 little dots there and then a little line and then 6 little dots in the back, right? So think about it like that. Your body is a chess. You have 9 dots up here, 9 dots in the bottom, 9 dots in the back, and 9 dots in the back, like upper back. So think about it like like a chest. Like this is the front part of the chest, the domino, right? This whole, don't look at my boobs. I'm just kidding. I'm sorry. So this is the front, right? And if you divide the domino, you have 9 little dots here, 9 here, go in the back, and you divide that to, like, you know, you have a barrier up here, the little line, and you would have like 9 dots there and then 9 dots down here. So that would be a total of, like, you would do 9, 9, 9, 9. And then your like wee area, that one is 1%. And then your leg, front leg is 9, front leg of the other one is 9, and the backs are 9. Okay. So we go back 9, 9 here, 9 here, 9, 9, 9, 9. But the legs, think about it like this. Your leg and your arm, they have, like, if you think about it, the size, the shape of them, your arm is, you know, thinner than your leg is, right? So 2 arms make 1 leg, you know? If you put them together, that's 1 leg. So you have a 9 and a 9, that's 1 leg. The other leg, your left leg or your right leg, whichever one, 1, 9, 2 arms make up 1 leg. Because your legs, if you take 1 leg, it's literally the same size of your 1 arm, which is 9, right? So that's why it's 9 in the front and 9 in the back, because you take the front and the back of your arm, make it into a leg, you have 1 leg here. I don't know if that makes sense, but I hope it does. So it'd be 9, 9, 9. Think of the dominoes, 9 here, 9 here, 9 here, 9 here. And your legs, they look like arms. So if you take 2 of your arms, it makes 18, because each arm is 9. Burns, they kind of ask sometimes about burns. You want to make sure, you know that the, I guess just a term, you know, but they do ask, like, if somebody has like black sputum, you want to make sure in their upper chest, no, or black fatty sputum, then you check for airway, because they inhaled like the you know, like those black smoke and fire. You want to know deep partial thickness and full thickness burns and shallow partial thickness burns. Partial thickness burns, deep partial, and then full. So deep, full, and shallow. So I want to make sure you know that. So partial, right? Partial, deep, partial, and full. Partial, deep, partial, and full. Now, if we go to page so you need 2 patient identifiers, right? Never use their room number. You can't use their medical record number. You can use your phone number. You can't use their doctor's number, their doctor's name, but you do need 2 patient identifiers. Before you administer med, you always want to make sure that it is the right dose, right dosage, and you check the MMAR to make sure it does coincide. If a patient tells you, I don't think I've taken this med before, then you go and look it up, because sometimes patients, they know which meds they take. And if it's not the one that they normally take, then you want to assess. So that was an ATI question. So, make sure you know that. Always, when you're doing medication administration, make sure you just know you have no distractions, right? You don't want any distractions, no errors. Always run if necessary, 5 and above, give it a shove, 4 below, let it go. You want to make sure that you don't have any leading zeros in your documentation. So like no 0.10, right? Except if it were a math answer, then yeah, you look for 0.10. If you're going to read something, right, liquid administration, look at it from the meniscus, right? You put this down here and it's going to like on a table and it's going to be, you know, at the meniscus. Always like when you're doing medication through like nasogastric tubing, you always want to give a med, put water, give a med, put water, right? In that order, in that sequence. So make sure you do that. Always assess for pH, right? You can either do it through listening, right? You put air in, or you can do the best way would be to do it through pH. The only reason why ATI doesn't suggest doing it through you know, the stethoscope is because like that same sound is the same sound that you would hear as if like the G tube or the NG tube was in the lungs. So it can kind of like misguide you, and you're gonna say like, okay, well, you know, this is the sound that it isn't located in the stomach, but it's not. So best way would be do a pH less than 4. Sometimes on ATI it does say less than 5, but anything that's acidic. Think about the pH scale. Anything less than 7 is acidic. But the stomach acid is like around 4, 3, 2. But that's the best way. The most accurate way would be X-ray, but I mean, we don't have money for that, so no. But pH, yes. So you want to do that. Make sure when you're doing eye drops, you look up and you put it in the conjunctive sac, right? Always clean from inner to outer, never from outer to inner, because that introduces bacteria. If you're gonna make sure it's close on the ATI, I know it's very precise on how much it should be, like 1 inch or 2 inch, as close as you can get it. So I want to say it's like 1 inch, but I'm not really sure, but I know it's as close as you can get it. So nothing like 3 inch away or 4 inches away, about 1 or 2 inches, right? And you lower the conjunctive sac and you apply your medication. For ears too, if you're gonna do the panic ear check, if you're an adult, 18, think about it like this: you're 18 years old, you're old, so you're a grown up, right? And the word grown up means up and back. If you're less than 3 years old, you're a child, you're little, down and back. So that's how, because you're lower in height. As you're an adult, you're taller in height, so up and back, down and back. So, you also want to apply, after you apply eye drops, you want to put pressure on the lacrimal ducts. These are your lacrimal ducts. 1 to 2 minutes, put pressure on here. That one shows up on ATI, so make sure you know that. You want to make sure that if you're inner to outer, clean it, right? What else? A spacer, sorry, I'm just giving 461, page 461. Spacer, you want to use it for MDIs. You want to make sure that you are using a spacer because you want to avoid patients who's taking prednisone to not acquire candida. If they acquire candida, now you're gonna have to give niacin, and that's a whole nother story. So you know, a spacer is better, and it also allows it for better distribution of the medication. So spacer is better. Sublingual underneath, like your nitro, that's sublingual, goes under the tongue. Insulin medications, they have the units, right? That's on page 466. If you're going to give a TB med, make sure you know your intradermal is 15, your subcutaneous is 45, but if they have a little bit of fat, you can give them at 90 degrees. Your IM injections are at 90 degrees, all 3 of them. So you have your deltoid intramuscular injection, where you put a finger on the acromion pulses and then 3 fingers down, right? I know on ATI states like you put 1 on the acromal process. If you know that word acromal process, you're gonna get the question right. Anything that's acromal, it's right here. But I don't know if it's 2 or 3, but as long as it's in the acromal process, should be fine. 90 degrees, right here in the middle of the triangle. Vastus lateralis, IM, that's on the leg. The way I think about it is vastus lateralis, lateral side, the leg, it's lateral. Then you have your vastus gluteal, right, on the butt cheek. It's always the opposite. If you're gonna inject on the vastus gluteal, it's on your left side, you use your right hand to like do it. It's always the opposite, It's 90 degrees. Never give an injection via deltoid. Not deltoid. Okay. Vastus gluteal. Vastus gluteal. What term is it? Hold on. Where's the gluteal? Sorry. Oh my gosh. Dorsal gluteal. Never dorsal gluteal. Right, because it has the vagus nerve there. You don't want to put it there. And on page 470, that's where I'm looking at these injection sites. The deltoid. So deltoid, you put a finger down and please for yeah, so it's 3 fingers. So 1 on the acromal process, put 3 fingers down, it's total of 4, and draw your little triangle. Okay. Oh, if you're gonna give an IM injection, such as like anything, like I believe iron can be given via Z-Track. So that's an IM medication, but the thing is, like IM, you can do the Z-Track method where you pull the skin down and like you inject the medication and you pull the skin back up. So that medication goes in the intramuscular, like the muscle, and it moves the fat away. Page 472 has a picture of that. So I believe you can do it, because heparin is sub-Q, which is, and then you can give it in the abdomen. But you can do that with any IM injections, except intramuscular like TB. TB, you don't want to rub it, you want to have the blood there. So Z-Track method. So yeah, so let me see, what medication was it? You can give it via Z-Track. I just saw it like earlier, but there is one medication that you can give ZM. Forgot right now. Weights, when you measure weights, make sure warm room in the morning. If you can, same clothes every day, same scale. Try to keep it like not having like add extra weight or like have a watch on, no shoes on, right? Potassium, you have to know your potassium. This does come up on ATI, and you have to know your potassium foods, so your apricots, your oranges, navel oranges, they do come up on that. Navel oranges, potatoes, leafy green vegetables, your what was it? Apricots. I don't know if I already said that. Apricots. Dried fruits, they also come up in there. So bananas, cantaloupes, also cantaloupes. So make sure you know page 486. You know your bananas, apricots, leafy green vegetables, calcium, phosphotribose, same signs and symptoms like hypomagnesium. If you have a hypomagnesium, you're gonna have triglycerides and tentamine and trosus. That did come up on ATI. So I'm sure you know that. I'm sure you know your pH balance, your what do you call it? Your pH 7.35 to 7.45. And write it down like on a scale if you have time, like 1 to 7, 1 to 7.35 is acid. 7.45 to like 14, that's alkaline. You need to know your PaO2. PaCO2, sorry. PaCO2, same numbers, 35, 45 is pH, and HCO3, it's 22, 26. Now for PaCO2, that one, they're just flipped. And I do have a YouTube video on that one. If you guys want to check it out, it's kind of like weird. But it does go over the way Mr. Chris taught it. So make sure you know that one. And PaO2, that one did come up once, but that's for the oxygen saturation. That one should be 95 to 100. And then just random, but like for COPD patients, their normal range is 88 to 93%. So if on ATI, it's like, oh, patient with COPD has like a 93% oxygen, then it's fine because that's expected of them. Make sure you know your respiratory alkalosis, respiratory alkalosis, metabolic alkalosis, metabolic acidosis, and respiratory acidosis. Respiratory acidosis, that can include like COPD, right? That's one example. Respiratory acidosis, respiratory alkalosis, like asthma, hyperventilation, like anxiety. Metabolic acidosis is more of like DKA, kidney problems, metabolic acidosis, diarrhea, DKA, kidney problems, and metabolic alkalosis is vomiting. TPN, bulimia, right? You're constantly vomiting. So there's that. I mean, I have a little thing. I can add it to the YouTube stuff. It has like a list of which ones are which, but please make sure you know them. There is one at ATI that does come up where it has little things like the stats, labs for the acid-base imbalance, the ABGs, and then states somewhere on it that somebody's having a difficulty breathing, respirations of 7. The answer is metabolic acidosis. Because if you think about it, you can do it just to verify, but if you think about it in the statement, it says it's respiratory problems, so you can eliminate metabolic acidosis and alkalosis, so that gives you 50-50. And it says, like, I think it says it's or they had it for a while or something like that, but it's metabolic acidosis. I know that. Or you can actually, solve the problem just to make sure it is, but that one does come up. Cardiac catheterization, patients should be in a dependent position. So laying flat for about a good, I want to say 6 hours. I think that was the answer in ATI. But you want to make sure that they're dependent. You put a sandbag on, let's say if they had a left femur cardiac catheterization, you put sandbag on top of it. So that way there's no bleeding. Always assess for respirations, any cardiovascular changes, blood pressure, heart rate, pulses, you want to assess consistently. And because it is a major invasive surgery, consent is important, and monitor vital signs every 15 minutes or so. So there's that. Consent is important. ADEC are your fat solubles. Please make sure you know, because like I know for sure, I feel like a lot of like medications for pharma they're gonna ask are more cardio related and cardio related. But they also ask about your statin medication, like your cholesterol lowering medication. The way I think about statin is, do you guys think about this historian person from back in the, I don't know, I'm so bad with history, but back in the, a long time ago, I believe it was Russia, and they had like a dictator, and his name was, I think it was Statin. It sounds like Statin, but he was kind of chubby, a little bit. Yeah, I think he had a mustache. He was kind of chubby, but I feel like a dictator, you know, as dictator, he would have like all the food that he wants and everything, so he has high cholesterol because he's, you know, dictator. So statin. Now, statin has an overall cholesterol of like 400, which is really bad. But with this medication, statin, you want to make it lowers down your cholesterol levels to go within to drop within normal range. So you would have a total cholesterol level of, you want to keep it below 200. You want to make sure the triglycerides are below 150. Your LDLs, you know, not your good, bad. You want to make sure that you keep it below 100. Your HDLs above 60. Always take medication at night. No St. John's wort, or in the evening, as ATI states. No St. John's wort, no grape juice. If it's prorostatin, that's the only medication that you can take with I believe grape juice. And report any muscle tremors, anything that has to deal with your muscle, because that indicates an adverse effect on the medication. And check your liver, ALT, AST for any jaundice. But yeah, that's a whole nother level right there for farm. Right now I'm just trying to go through this. So if patient doesn't has a lot of alcohol consumption, right? Make sure that they have an adequate intake of vitamin B6. And with vitamin B6, you need an intrinsic factor, because if you don't have the intrinsic factor, you're not absorbing vitamin B6, and that can super make this enemy. So make sure you know that. Folic acid to prevent what do you call it? Neural tube. Sorry. Okay, but vitamin K. So green leafy vegetables, right? Liver, meat, know your protein for sure. Let me go drink some water. Okay, so water, make sure 2 to 3, right? If we don't have water, in patients, little kids, the sign and symptom of dehydration would be a weight loss of 10%. That's an answer on ETI. So that was repeats. But make sure, you know, you're gonna have when you pinch their skin, it's gonna like kind of like, you know, not go down. Oh my gosh, I don't even know. I'm talking right now. But they're gonna have dry skin, you know, poor skin trigger. There we go. Poor skin trigger. They're gonna have dry mouth. Worst case scenario, they can go into shock with this. But I'm sure drinking about 2 to 3 liters per water every single day. Let's see. What's UTIs, you avoid prevented cotton underwear, no nylon, white front to back, not back to front. Drink water. You can do, make sure that you don't take any, you make sure it's preferably to take showers in bathtubs, right? Because that way you don't get the germs, bacteria going back into your wee, so all that stuff. Clear liquids, popsicles, coffee, black coffee, gelatin, broth. Those are good, right? BMI normal range is 18 to around 24, 25. That's normal, like the normal BMI range. The way I think about it is you're 18 years old, right? when you graduate high school, average, and then you're about 25 when you start having kids. Well, in general, 18, 25, that's normal. 30 and above is you're obese. 26 is overweight, but 30 is obese. BMI. Age less than 4. Someone, if you're a CNA and you want to feed somebody, make sure, and you're blind, make sure you guide them towards like how to eat it. Like at 1 o'clock you have your spaghetti, at 2 o'clock you have your muffin, at 5 o'clock you have your beans. So that one comes up sometimes. Please make sure ischemia, immunity, ginkgo biloba, ginger, ischemia, St. John's wort, never take it with anything else. Okay, so now chiropractor, it's good, but if you have osteomyelitis or if you have osteoporosis, it's contraindicated. You can do biofeedback. You have like the electronic stuff, stickers stuck to your head. You can do imagery where you envision yourself in like a paradise. You have reflexology, where your feet, right? There's certain pinpoint areas that the person who specializes in that area, they can press there and they fix. Okay, I know, but they like heal that area, right? Like let's say this is like area for your menstrual cycle, and I don't know, you want to get that lower back pain fixed, so they would press on this area, not your hand, but like on your feet, soles of your feet. You can do Tai Chi. This is good for patients that have osteoporosis. It helps with that. Only thing with Tai Chi is, or any yoga poses, would be that if you have glaucoma, you don't want to bend down at the waist, because that can cause more pressure, in your eye. Or if you have like ICP, you don't want to be bending down. Pain, it's always what the patient states it is. On page 592, I'm sorry, I keep forgetting page numbers. But you want to make sure that grunting, nasal flaring, and sweating, it is what it is. It's patient's feeling, and you acknowledge it. You have to like respect it. Like if they say it's 12, it's 12, even though it's not. TENS unit, that does come up on ATI, and the way you apply a TENS unit is like, let's say your injury area is like right here, right? You want to put it above the site or near the site, but you don't want to put it on it directly, and it blocks the pain transmitters, right, from reaching that area. So one does come up sometimes. Opioids, cause sedation, constipation, decreased respiration, blood pressure, which is like hypertension. Oh, vitals go down. That's all I think about. Antidote, relaxone, right? Let's see, PCA, only the patient can touch the PCA at the onset of the pain. You don't want to do it after the pain or right when the pain starts, at the onset. Page 616, go over wound healing. Make sure you know your erythema, edema, erythema, edema, pain, heat, swelling, and tissue dysfunction, cardinal signs of inflammation. Make sure you know that. And the stages. Please make sure you know your stages. Right? You want to know your stages. Stage 1, 2, 3, 4. Transparent dressing, those are good, especially the tragomer for like ulcers. There was one question sometimes it comes up where you they ask about the answer is 35 millimeters syringe with 19 gauge needle. On page 629, that's the type of syringe, 19 or 35 millimeters, that you use to clean an injury. Remember when there's an injury right here? You guys can see it. This little needle right here, 19 gauge, right? With 35 millimeters of whatever substance it is. And you start from the bottom down because you go from clean to dirty. Always administer pre-medications right prior to it, but always clean, dirty. Lesions, eviscerations. The Lesions is like an it opens up, right, an injured area. Evisceration, the wound comes out. So first things first, call for help, right? MPO automatically. But you want to put the warm saline first on the organ because the body is warm, and lay them down. Sometimes I'll ask for the steps, but you want to think about it like the organ is priority over laying down. So make sure you do that. Let's see the in drainage. They do talk about the Jackson's Pratt. That's a little tube that comes out of your tummy. Like sometimes when you have a patients that have a gastric bypass surgery, so that would be when like your stomach is like, you know, this is the size of your stomach, right? Let's just say this. Let's just say this is your stomach, but not that. Sorry. Let's just say this is your stomach, right? And you have gastric bypass for those that are obese, BMI 30 and above, and they have a hard time losing weight. So what they have is an option of having gastric bypass, and what they do is, depending on what type of surgery, but in general, they would like cut the stomach in half, right? And now you have this is your stomach. So obviously you're gonna have bleeding, right? And so they put like this Jackson Pratt, right, coming out of like your abdomen, and it's like 2 tubes. And the way on ATI, how they want you to take care of it is after you're done draining it, like putting out the blood, you want to squeeze it. You want to leave it like squeeze. I don't know why I'm not a pro at this, but I know that you want to leave it squeezed because I was watching I follow somebody on Instagram, and she had the gastric bypass, and she was, you know, talking about how you take care of it. And she would always leave it like the little baggy squeeze. With gastric bypass surgery, patients also, you know, they're not getting the amounts of like, let's see, vitamin B6, they don't have a lot of like intrinsic factor to metabolize vitamin B6. They get prometheus anemia, so sometimes they have to be careful from that. They have to do small frequent meals. If you have what was it where you lay them down? There's one where you lay them down for alternatives. Dumping syndrome, one lay down the patient. So that's it, right? Yeah, it should be it. The other ones like basic surgical patients. 5Gs, you have to know 5Gs, right? Consent, allergy ban. Let's see, thermometer every 2 hours, like exercises, right? DBT, elevate your leg, put warm compression on there. Let's see. Thank you. Make sure those stockings, knee-high stockings, or the thrombolytic stockings, that they are not worn out, and you wash them in warm water. And you always assess for a post-op for any bladder distension, because you want to make sure that they urinate 3 to 4 hours post-op. If they don't, you assess. If they have a lot of, you get a ultrasound. If they have a lot of urine in there, then you you want to start from least invasive to the most invasive. Make sure you go to the bathroom, think of water, drink water. But worst case scenario, you're gonna have to catheterize. Anticoagulants, make sure you stop 48 to 7 days prior to surgery. Very important. Anticoagulants like your enoxaparin, heparin, warfarin, even like your NSAIDs. What else? 3 millimeters per hour is good. Please know your labs. I can state it right here. I can kind of help you guys, but I mean, other than that, you're gonna have to just know it. They don't really ask about skin lesions. They do ask about the stage 1, stage 2. Stage 1 is pressure injuries. Would be where you use non-blanchable skin. Stage 2 is the blister. You see a blister. Stage 3 would be you see your subcutaneous fat, and stage 4 and your muscle, your tendons, your ligaments. Stage 4 is you see all your muscle, your ligaments, your subcutaneous fat, all of those like substances, but no bone. Oh, but bone. Sorry. Fourth is the last. 3 you can't see no bone. 4th you can see the bone. See everything. And unstageable is like you can't stage it until like it heals or something, so that way you can stage it. It's really bad, severe. So herpes, HSV1, don't have sex when you have these lesions, right? Make sure you take your Aclovir, right? It doesn't heal, it doesn't cure it, but it does slow down the progression of it. It's kind of painful, right? Uric acid, this is another thing, but with I'll take gout. You want to make sure that you don't eat any red meats, no alcohol, no liver, no junk food in general, because that just provokes the acute attack. You don't want that. Drink lots of water for sure. But 2 medications that you would have to do is allopurinol, which is for long term, and the other one starts with C, called calamine or something. That one's for acute attacks. You have to know those medications. That one does come up. Please know those. Shingles, very, very painful, right? It is airborne precaution. Cellulitis, make sure you put warm compression, right? On page 1293. It is bacterial. We put warm compressions on there. Impetigo, what do you call it, crust? Because kids, Tinea capis, tinea pedis, your feet, tinea jochus, your like jock area, and tinea corporis, like corpse, or I don't know, but it's the body. These are fungal. You can use a woodman's lamp, wood's lamp to assess where it's at, or what it looks like. But make sure you wash your clothes in a hot dryer for 20 minutes. Wash your clothes in hot water. If you can't wash it, you can bag it up for I think a couple of days. I forgot, but that's in peds. We mentioned that. Dermatitis. Make sure if somebody touches something, right, and you have urticaria, make sure they wash it out with cold water. And you can give them calmoseptin lotion. You can calmoseptin like it calms the problem down. What dressings should be used? What do you want? Right. Urticaria are like hives. Diarrhea is just like allergic reaction to like hives or food. You get like like wheals on the skin. You do want to make sure you assess for help the patient, with the price, with the itching. You can give them what do you call it? I believe you can give them an antihistamine. Angioedema, swelling of the tongue, right? And it's priority because if you have swelling of the tongue, you have impaired breathing, page 1300. Acne vulgaris, this one came up on UTI, ATI, but there is one medication is atropine. Just kidding, not atropine. Oh, okay, there is a medication, Accutane. Sorry. I'm so tired. Okay, there's Accutane, and Accutane came up on Farm. This is where they have to have 2 negative pregnancy tests prior to starting it, and then after they stop the medication, because this is a very powerful medication that does cause fetal defects. So it's very important that they do not get pregnant. And it also assess for behavioral changes, because it does kind of mess up with the behavioral changes that leads to like suicide. So those 2, but it's only given for severe acne, but it does come up on ATI. So it comes up, it's pregnancy. Don't get pregnant, right? Lupus inflammation, it's idiopathic, so we don't know the cause of it, but you give them prednisone to decrease the inflammation, because they're going to have page 1504. You're going to have just inflammation around like you're going to have the butterfly rash. They have exacerbations and remissions of it, mainly more in African Americans. Epitoxis, this is lice, what I was talking about. Warm water, warm. Your dryer, want to make sure you get all that stuff out. Hot water, wash your hands or wash your clothes in hot water. Scabies. Make sure, scabies, they're like on the hands, like in the folds of your hands, very itchy. Only at night. Scabies, they come in at night. I don't know, memorizing some, but yeah. Keloids, overgrowth of collagen formation, so mainly more in African Americans. Nevis or moles. Your cancer, your basal squamous. Basal, it's like a base, small little base at the bottom of the base. Basal. Squamous sounds more like somebody squashed something. So spreads. It's more malignant, more dangerous. Malignant myeloma, malignant. Please know you're 9. Somebody has black sputum, make sure they cough it out. Airways priority. Please make sure on page 1335. Inflammatory RA. That is inflammation of the synovial joint, and osteoporosis. Osteoarthritis. Osteoarthritis, we want a firm mattress. That was the answer for one of the 8 answers. Firm mattress for that. You want to make sure for RA, you give them warm and cold heat pads to help with the pain and to help with the synovial inflammation. But you definitely need to know them too. Rheumatoid arthritis, their lab is gonna be high in ESR and C-creatinine. Those 2. You don't even know the numbers, but just know that they're high. They're elevated. C-creatinine, especially ESR. That one's elevated. DMARDs is used for patients that have what do you call it? Oh, do you want the Dextroskia, osteoporosis to assess for the holes in the bones. Osteoarthritis, it's the cartilage in the joints. They're not there. Yeah, make sure you know, assess for the uric acid, it's water, 2 medications, Purinol and whatever, I don't know. Purinol, long-term management, the other one, keto. Osteoporosis, mainly more in Asian little women, sorry. And if you have kyphosis, this is a cardinal sign for that. Kyphosis. Here, kind of bent down like that. Indicative of osteoporosis. Low weight bearing exercises, walking, swimming, helps with that. Intake of vitamin C, intake of calcium, vitamin D helps with that. Make sure one med that I need you guys to know by law, it's in the cards that Meyer had. Please know your steroid, your S's. Steroids causes sepsis, sickness, weight gain, cataracts, and osteoporosis. Hyperglycemia as well. What did I say? Sepsis, sickness, weight gain, osteoporosis, cataracts, and hyperglycemia. I promise you it will come up. Make sure you know that drug, because that drug is used a lot for patients that have asthma, patients that have lupus, patients that have I forgot, but it's an anti-inflammatory agent. So please, I'm sure you know that. Alternate, dronate, right? It sounds like a drone. It's very hard. Drones are hard. Tools, think of bones for some reason. I don't know. Drones, bones. Drone is hard. The bones are hard. You just, all I need you to know for that matter is you sit up for 3 minutes after you drink that med. Because if you take that med, you lay down, get stuck here, it causes epiglottitis, inflammation of your epiglottis, basically. Just make sure you stay. Don't. Anything else? First thing in the morning, lots of water. Fibromyalgia is pain, right? Abduction, make sure they're abducted with the pillows. Make sure it's less than 90 degrees, not more. You don't want to extend it more than you should. Compartment syndrome. Make sure that if they have pain that's not relieved with meds, if it's cold, if it's what do you call it? If it's not really without pain, then it's most likely compartment syndrome, and you want to make sure you get that situated, because it can cause necrosis of the tissue, and you don't want that. So let the provider know, otherwise you might have a facial otomy. So facial otomy syndrome. Okay. External fixation, so box traction, make sure the weights are hanging down freely. You can move them every 2 hours. If it's a skeletal traction, because it's a skeletal, clean the sites, assess them, vital signs, fluids, fiber, because they're laying down, rice, amputation, they have the faint and limb pain, but you want to make sure that they're prone every because you want to make sure that they are okay. You want to make sure to get the quick hip extension. So yeah, so I literally just kind of went over foundations right there. Really quick, you know, I'm like, just skim through it again if you guys can. I'm gonna go over the Myelogram. I forgot that one too. Myelogram, it's you consume a diet and it helps like assess for, you know, structures, herniated discs and stuff like that. But just the Myelogram, make sure you drink lots of water afterwards because you don't want the substance, the contrast medium to stay in their system, and you always assess for any allergies to iodine and shellfish. And yeah, just make sure lots of water. And $3 position for stomach box position. Lots of water, and don't get up, don't ambulate because you're gonna get a headache. So there's that. That's it. Veniostasis. That one's in med surg. We can talk about that one tomorrow. Knee-high stockings or the socks. Make sure you wash it in warm water. That's it. Transportation, everything. Make sure you do those questions. Okay.